Hi, I'm Kurt Veely. I'm the Director of Research at Berry Consultants. I'm joined with several Berry consultants who are talking at RSIW in a couple weeks about various topics. We're happy to be back. Berry should have a big presence at this meeting. Each of the speakers is going to give a brief intro of their talk, and we're going to start with Tom Parke, who's talking about optimizing trial designs using machine learning techniques.
Thank you, Kurt. Yes. So I'll be talking at 1:15 on Thursday. And what my talk's going to describe is an experiment in optimizing a clinical trial design using machine learning. So we have a design. We picked a group sequential design to optimize because that's a kind of very well understood kind of design. And there was a lot of questions we really wanted answers to. So was it, did the machine learning converge on an optimal point? How long did it take? How hard was it to do? And also, was it even worth doing? Did we like where it ended up? How sensitive was where it ended up to? Also, a bunch of extra assumptions you have to plug in to do optimization. So yeah, I think it was a very interesting and project. I think people will be interested in the answers.
Thank you, Tom. Giorgio Paulon is also speaking at RSIW. He'll be talking about enrichment trials and some very successful trials with multiple groups.
Thank you, Kurt. Yes, I am Giorgio, statistical scientist at Berry Consultants, and I'll be presenting in a session titled Planning Heterogeneous Treatment Effects on Thursday, September 25th from 1:15 to 2:30 p.m. Eastern. In this session, we will explore how adaptive clinical trials can respond in real time to the emergence of heterogeneous treatment effects. In fact, you can imagine that often therapies benefit certain patient subgroups more than others, and enrichment is just a strategy used to identify and focus on those patients that are most likely to respond to a therapy. I will share two examples from the field of intracerebral hemorrhage. The first one, called the ENRICH trial, is a completed study that successfully applied an enrichment strategy and has already reported the results. And then building on those lessons, I will discuss the design of the follow-up clinical trial called the RISW trial that is currently underway.
Thank you, Giorgio. Joe Marion is going to be talking about the problem of multiple endpoints, how to combine them using various borrowing strategies. Joe.
Yeah, so Joe Marion, statistical scientist here at Berry Consultants. I'm talking in session PS25 at 8:30 a.m. on Friday morning. I do a lot of clinical trial design in rare diseases, especially rare genetic diseases. And oftentimes these are cases where there's no single endpoint that really captures the full breadth of the way a disease impacts a child or an individual. And so what we've been working on is Bayesian methods for combining multiple endpoints together to provide more powerful tests. We're trying to stay away from a paradigm where we do, like a composite or something like that, but instead borrowing strength between different endpoints so that if a drug impacts multiple endpoints, it should have a more powerful result. I think this is a really scientific kind of approach, and it reflects sort of our underlying belief that in trials of genetic medicines like gene therapies or antisense and oligonucleotides, we really should see impact across multiple domains when we run a clinical trial, and this methodology reflects that.